Perfekt. Vi fortsätter den här temadagen på Erik Penser Bank. Nästa bolag ut är då Aino Health. Vi har med oss bolagets VD här, Jyrki Eklund. Varsågod.
Tack. And I'm going to drive this presentation through in English language, but then afterwards the questions can be held in Swedish, so no problem with that. But yes, CEO of Aino Health, and the meaning today is to go a little bit through where we are coming, what we are doing, and where we are aiming with our software as a service business line. And first, if looking a little bit background, so we have a little bit, I would say, quite a long history behind us, and history fulfilled with lots of research work to understand the employee and individual health and well-being, and what are the, let's say, main drivers to maintain a good well-being and also workability in a working environment. 2010 we started to digitalize all this know-how as a SaaS product what we have today, which is called Health Manager. We are coming originally from Finland and moved over the headquarters to Sweden, to Stockholm 2016 when we did the IPO here together with the Penser Bank. We have till today served a little bit more than 150 companies, helped them to digitalize the health management processes, to take a grip about the employee health, well-being and engagement part. Our main customers are mid-size, big organizations, both from the public and the private sectors. And there is no specific industries, for example, where we have focused. So basically we are working over all industries. Doesn't matter if it's a heavy industry, is it the IT or service type of industries. What we are then doing, the ultimate aim is to help the organizations to take a grip of health management, health-related cost and employee engagement. So basically, in a simplified way to say, how to take care of the employee population. In our processes, the individual is always in the middle of the process, and that's what we are interested in, and that's how we are helping the corporations and organizations to take care about the employee population. So then, why we are in this business? There's a very few who is talking about the real facts about the health management and why we should be interested about that topic. But when we did this research work in the early stages, so we realized that there's, of course, always sicknesses involved, and in a way, physical health-related topics. And those basically are covering, if we are talking about the white-collar organization, approximately 1% if looking in a yearly basis. And in the blue-collar organizations, these physical health-related challenges covers approximately 3%. But then our question came from that angle, that there's many organizations where the sickness absence rates are 7%, 10%, or even we have seen, for example, public healthcare organizations where in some departments the sickness absence rates goes above 20%. And this was what we were interested. What is between this, what we are calling normal sickness absence, and these real numbers, what we can see? If those real numbers are not totally related to the physical health-related problems, so what is there behind them? And that was the interest area to, in a way, dive deeper in and understand what are the root causes for health and well-being. And one part of the studies, what we did was based on this type of picture, what you are seeing here. It's called Workability House. And in the lower floors, you can see these physical related things, health and functional capacities. That's related to those 1 and 3% what I was mentioning in our previous slide. But then what comes then above, what has the effect to the total numbers, is not so much health related anymore. There's the, for example, individual competence, the values, attitudes, working environment, leadership, and of course outside things like your situation with your family, with your social environment, and so on. But what we saw quite quickly when diving deeper into this subject is that the biggest impact to the employee health and well-being comes from the leadership side. So how the managers, how the management are dealing with the employees, how they are supporting the employee well-being and health. So what we did then, we started to put together one of the first what we are calling ecosystem platforms to help the organizations, to help the HR, human resource departments to take a grip about these things, to make it possible to the managers to deal with these things fast, quickly, accurately, and in a right way. And the challenge with the many human resource people and the department has been that there's absolutely a good will to support the employee population. But the challenge is that nobody really did know what to do to get the tangible results, to get the engaged employees. What are the methods, what are the things, what should be done? And what we did, we collected in our SaaS platform all the most important things that are really creating tangible results as an outcome. And in the same time, we helped the HR organizations to digitalize the whole health management process, to speed up the processes, to make it much accurate, and most importantly, to support the managers in their activities towards the employees. So why this then matters? Why should somebody be interested about this topic? I have here a couple of examples. One is from the automotive industry. One factory with 38,000 employees. Sickness absence per year per employee was 17.5%. Cost related to this is almost 300 million euros. Which means if we are turning that upside down, they need to produce approximately 20,000 extra cars just to cover the health-related cost and sickness absence-related cost. Of course, you cannot get this figure to the zero, and that's not absolutely the meaning, but you should easily get this in a half, which must mean only in this one factory that they would save approximately 150 million euros in a yearly basis. So we are talking about money, we are talking about the profitability, we are talking about the competitiveness. But we are also talking about the employee sustainability. So how we are treating our employee population in a correct way. Why this is important? Nowadays, when the younger generation is coming to the new working place, so of course, salary is one parameter what they are looking after. But that's not the only one. They are also looking after how the company is caring about the employee population, how the company is supporting them during their working career. And employee sustainability, if we are reading bigger organizations' sustainability reports, so those are normally extremely good ones. There's a lots of good content. But when we are coming to the area where we are discussing about the health and well-being, so the content is very thin. Which means, in other words, that there is not really KPIs, there is no real processes, there is no real measurements that companies are doing to measure how successful they have been related to this employee health and well-being. In other way, our study shows that 86% of the visits to the doctors could have been avoided if we are working in a preventative mode, which means that we are not medicalizing things, we are taking care about the employees at the right point of time with the right actions. We are supporting them. We are in Europe or in the Western countries, we are very easily medicalizing things that doesn't have anything to do with the medical conditions. And that was shown in the picture what you saw from the Workability House. So of course, if a person is sick, then we need the medical care or something like that. But if the root cause is not medical, if it's, for example, in a competence, if it's in a working environment, so it's unnecessary to medicalize those things. There we need other type of actions. We realized also that, as I said before, HR has a good will. They absolutely want to do things related to this topic. The only challenge what they had, they didn't have a proper tools how to manage this. If you are thinking about the organizations which has, for example, over 1,000 employees, and you should in a daily basis be aware what is happening in each department inside the organization. It's mission impossible. How can you manually see, are the managers taking the early intervention actions towards the employees? What is the quality of those actions? What are the next steps, what will follow, and so on? There's no way that you can do that manually. It's a relatively complex process from start to end to follow. And that's why there's a huge need for digitalization in this area. The other thing is related to GDPR laws. And many of the organizations are aware that they are not in this health area totally following the GDPR. But when digitalizing these type of processes, the GDPR comes automatically involved in this type of solutions. So, if we are looking at what we are then doing, our mission is provide sustainability solutions for corporate health management to achieve human and financial results. And when looking a little bit what are the corporate health issues, so there's an increasing cost, impact through leave of absence. And these costs are hitting the bottom line basically. It has an impact to the profitability, it has an impact to the competitiveness. Then there's a lack of transparency when we are talking about the employee sustainability. So how we are treating our employees in an equal way. There used to be the trend that some of the managers were very good taking care about their own employees. Maybe 1/3. 1/3 had the will, but they didn't know what to do. And 1/3 really didn't care about. And this is creating problems with the transparency, how we are dealing with the employee population. So as I said before, our SaaS solution digitalized this all needs what is in a corporate health management side. So digital platform where we have processes integrated, where we have data analytic integrated, so we can take extremely quickly a grip about the situation and what needs to do and where we need to do actions. We have a root cause analysis where we are finding out what are the real reasons why people should have help and what type of help they should have. As I said, one part might be the medical, but there's lots of other things involved in these processes when looking to the root causes. Then management and prevention of leave of absences support employees, managers, and HR with the real actions, what needs to be done. And then as an outcome, there's a reduction of short-term absences and there's a reduction of structural long-term absences. So in the end of the day, if we are looking at the outcome, so there's a cost savings, there's an increased productivity, there's an employer brand image. And that employer brand image is related to that, what I said earlier, when younger people are choosing their working place, they will go to places who are taking care about them. When we were talking about the ecosystem platform, so I will explain that a little bit. First of all, our solution is just-on-time solution, which means that if for some we see some signal that the employee is not feeling well or there's challenges and so on, so the process starts immediately. And this means that our SaaS platform will inform the employee in the first hand that we are starting an early intervention process, and right after that, the SaaS platform informs the managers what he needs or she needs to do to help and support his or her own employee. Normally, it's a game between these two, a manager and the employee. But in some cases, the manager doesn't have the tools or know-how how to solve this issue. So then this case can be transferred immediately to the, for example, occupational health care, in some countries to the health insurance companies, in some cases, for example, if it's competence-related thing, to the HR department. To this platform, you can link also other type of services, like telephone services, answering if people are feeling sick. You can connect the telemedicine services in a need basis. So everything what is around the health management process can be packaged in our SaaS solution, which means that we can every second collect data, we can do the analytic, and we can see the root cause analysis. And what this means, we are learning every day, and our client organizations are deep learning what is going on. If we are looking a little bit the platform itself, so we view of individual employee, very precise view of that. What is the current state situation? What has happened in the history? What has been the financial impact involved in this specific case? Then, if looking at how the managers are using the platform, so they don't even need to look into the platform. If they need to do something, they are getting automated alarm, which is guiding them what they need to do next. They have a clear processes, they have a clear list where they need to put the actions, what they need to do, when they need to do, and how they are doing this. And whatever they are doing during the process, everything is documented inside our SaaS platform, so we can also follow up the quality, and we can also see if things are not proceeding as agreed, what needs to be done, and do we need extra support. This is shown also in the reporting, which means that we have a very comprehensive reporting tool with the drill down functionalities, so we can see basically all the time the overall picture, how we are proceeding, what are the costs, where we might have challenges if looking, for example, bigger organizations. And we can dive deeper into the organizational unit level and so on. So basically, I would say in a milliseconds or seconds, you can get the grip of the whole organization, what is going on, how we are doing. And the more data we are getting in, the more we are able to analyze the data, which means that step by step we are approaching the predictive data analysis. And this is a beautiful thing, because the most important thing in the future is that you are reacting in early stages, not at that time when something has already happened. And data is a king in this game. And there, Aino Health, I think we are having one of the biggest data banks what comes to the predictive data analytic in this area. So, what is then the outcome for those customers who are implementing our software as a service module, Health Manager? Normally, what we are seeing during already the first year, Savings in a health-related cost are between 20 to 50%. So if we are talking about the euros in a mid-size or a little bit bigger organizations, we are talking about millions of euros. What are the savings? This money are shown directly under the last line of financial statement. With the extra services like a help desk and so, we can also have an impact of the length of short sickness absences, and with the short sickness absences, I'm talking absence rates from the 1 to 5 days. And normally if a person is going to the medical doctor, so they are signing for 3 to 5 days, and that's it. In this type of combined help desk service, so the average sickness absence is 1.5 days. But the most proud thing from my side, or where I'm most proud, is the client satisfaction rate, what we are measuring in a yearly basis in a scale 0 to 5, and we are scoring there 4.6. And that shows that something what we are doing is really valuable, not only to the organization, but also to the employee population. How we are then working? Normally the first step when we are contracting a new client is a health audit. So short data analysis from the current state situation, looking through what the data shows, looking through what type of processes they are using today, what are maybe the needs for the change in the processes, guidelines, and so on. And in this phase, we are also introducing Aino Health best practice model. And when I'm talking about the best practice model, it's a proven model where we can see that if organizations are using that, so we can guarantee the results. Then the next phase is training and implementation. Technical implementation is pretty straightforward. We have basically ready APIs to almost all commonly used HR or payroll softwares where we are taking in the organizational data. So from the technical point of view, we are talking about the implementation process, which is basically from 2 to 3 weeks, maximum 4 weeks. And then the one important part of this implementation process is this training. And with the training, we mean that how managers get familiarized with the health management topic. It's not so much technical training, it's more attitude training, what they can do, what they need to do, and what we are following via the platform, how they are progressing. Then the third phase is basically support, and some cases the clients doesn't have their own resources to secure the rollout in a way, at least in the bigger organizations. So we or our partners can stay there for a while and secure that everything is moving forward smoothly, and we are starting to receive those results what we are waiting after. So, with whom we are then working? As said, so we have worked with many companies, but I just pick up here a couple of those, and reason why I have these names here is just to show that what I said in the beginning, that to us it really doesn't matter in which sector we are working. It can be a public organization, private organization, and it can represent different type of industries. So from food industries, heavy metal industries, consultancy, and so on. And the outcome is always the same. And why it's the same? It's a very simple explanation to this. Human being is a human being. Are we then working in airlines or in a mining company? What is then our business model? We have basically two models. One is a traditional SaaS model, so we are taking a license fee per employee. The second is very unique. It's a profit-sharing business model. And this business model we have been using mainly with the public organizations, and that means that we are not taking any down payment, not any monthly license fees. Where we are taking our money is from results. And normally, if we are receiving results, we are taking 45% of the savings, 45% of the savings goes back to the organization, and 10% of the savings goes back to the employee population. And we have been very successful in these cases, so we have not basically failed any time. And this is also, to some organizations, a secure way to start if they are wondering that does this type of model work in their organizations, because many are thinking that they are different than the others. But yes, it's working. Then if we are looking a little bit sales. So latest deals, what we have announced is one of the largest gaming companies here in the Nordic. Unfortunately, we cannot say the name, but I think everybody knows that. Then just yesterday, we had a very good news. So we had done a pilot with a Swedish-based company, Transcom, in the Swedish and Norwegian departments. And now, yesterday, they decided to roll out this all over to Sweden. So they were very happy what was the outcome of this pilot project. And of course, today, I'm extremely happy that we can continue the work with Transcom. It has been a really, really nice cooperation. And then if looking still the sales, there has been a questions asked from me that what is the impact of this COVID-19 to our operations and does it show? Yes, I would say that in the spring and summertime it was quite quiet, but now the sales is picking up quite nicely. And one of the reasons I think is that with our help of our tool, so people can or organizations can really have a grip of their employees even they are working remotely. And this is a very important point because we know from the studies that, for example, mental health issues is starting to go upwards now during this COVID time because people doesn't have any more the social environment around them. What we will do related to the sales, the first and second quarter next year, we will put almost all our resources here in Sweden. And why in Sweden? In Finland, we have a quite good progress already. We are doing a black numbers. We are growing in Finland. In Sweden, we need to focus more. We need more resources, and we need to show that we can also drive through in this market. The good thing to start this, what I could say, positively aggressive sales approach here in Sweden is that we have extremely good references already from Swedish market. We have a Botkyrka Kommun, we have a Transcom, we have from an IT sector, Centric, we have from Industries, BE Group, and so on. So there's a very good ground to move forward and really start to sell through this Swedish market. This means also to us that we are investing now quite a lot effort and also money to recruit new people into the Swedish organization to help with this, to achieve this target, what we have for the first half next year. Then if we are looking otherwise, the outlook, so we are still working to enrich our data in our Health Manager solution. We are more and more going towards the predictive analytic with the help of the data, what we are getting in. And then we are also focusing from the mainly sales side to our partners. The partner network is working extremely nicely already in Finland, but we need to strengthen that also in other Scandinavian countries and in the middle of Europe. And then, of course, the outlook, how I'm seeing it, it's growth. I wouldn't say this still a couple of months ago, but now when I'm seeing how much meetings we are having here in the coming months, so I'm assuming that it will be relatively nice year ahead us. And then my favorite old picture, what I have showed also before, is do or do not, there is no try, and we will do. That's the case of Aino. Thank for your time and interest. It was a pleasure to be here and have the opportunity to show where we are standing and where we are aiming. Thanks.
Perfekt. Tack så mycket, Jyrki.
Tack.
Jag tänkte fråga lite, du var inne och touchade på det, den här partnerstrukturen. Kan du utveckla den lite? Vad är det för något ni får ut av ett partnersamarbete och vilka typer av partnerbolag vill ni leta efter, så att säga?
Jag skulle kanske börja med situationen i Finland i nuläget. Så där har vi ganska många partners som jobbar med företagshälsovård, som har relativt stora företag som de hanterar. Och den har fungerat väldigt bra. Men nu om vi tänker till exempel Sverige, så företagshälsovård är inte i Sverige så stark eller så viktigt kanske som det är i Finland. Så här vad vi är lite efter är annan typspartnerna. Till exempel som vi har skrivit under Salaris som är HR och payroll outsourcing företag. Lika typ, det kan vara teknisk partner eller sen kan det vara konsultativ partner. Och det vad vi ser att den möjlighet eller stora möjlighet som vi har här med partnerna är den att vi har färdig produkt. Alltså det är väldigt lätt att integrera till exempel till någon konsultbolag som jobbar med HR-tjänsterna och så vidare. Eller till och med till IT-bolagarna som tillverkar lönesystemen eller HR-systemen. Så det är lite där vartåt vi tittar just nu.
Om man tittar på, om ni exempelvis som tar Salaris som exempel, där skrev ni väl avtal, det var väl i våras som de kom. Hur lång tid tror du att de kan vara liksom uppsjungna på ert erbjudande och kunna liksom verkligen sälja er produkt via deras kanaler? Är det någonting som kommer att ske under nästa år eller hur lång tid tar det innan de är utbildade och klara?
Ja, jag tror, eller inte tror, jag vet att det tar en viss tid med de här större partnerna att få sakerna på gång. Det är först att utbilda deras egen försäljningsmänniskorna. Sen är det att göra allt marknadsföring, material tillsammans och så vidare. Men jag tror att från min del att det lönar sig att satsa på sådana här partnerna. Därför att sen när vi lär känna oss bra så borde det vara väldigt stora möjligheter, inte bara åt Aino men också till partnerna. Därför att de får faktiskt någonting nytt som kan nytta deras kundbasen.
Och ni har precis genomfört en ny emission, tagit in lite drygt 16 miljoner kronor. Vad kommer ni använda pengarna till?
Jag skulle säga att största satsningen kommer absolut att vara till försäljningsaktiviteterna. Absolut största. Och sen näst största är att vi ju hela tiden vi vill utveckla vår SaaS-plattform. Och som jag nämnde också här i presentationen så den här Predictive Data Analytic, den är en del vart vi kommer satsa en del av pengarna. Men om jag skulle säga att vilken är det absolut viktigaste saken vart vi satsar är försäljningskapacitet och aktivitet.
Perfekt. Tack så mycket, Jyrki.
Tack.
Tack så mycket för att ni har tittat.
Tack.